Hello, my name is Kenny Chan, and today I want to talk about interaction between patients and healthcare professionals and why this is so important in the healthcare field. It's my belief that those in the healthcare field or those going into this field should be trained and have a lot of experience dealing with different types of patients. It's a major part of the health field because healthcare professionals are giving out diagnosis, treatments, and recommendations to patients that are trusting that professional to know what they're doing, to know exactly what treatments are best for them, and to know their overall situation. Having a good client interaction can also demonstrate the healthcare professional's credibility, and it can also help motivate the patient to follow the recommended treatment plan, since if the patient understands fully what's happening, if they understand what type of medication they're taking or what type of treatment they're going and the effects of this treatment or medication, these patients will likely continue taking these medications or follow the treatment plan better. Therefore, by educating the patient, by teaching them what to do, and explaining to them in a way that they understand, they can take their health more seriously, and they will be able to improve their health on their own, since doctors can only do so much from their weekly or monthly checkup. So, a major requirement in the healthcare profession is to be knowledgeable on the types of treatments and the pros and cons of each treatment. It's highly irresponsible if the healthcare professional doesn't know what each medication is doing and if there's any side effects. If this professional is just prescribing out medication to random patients without explaining fully the effects and any side effects that these medications could cause, it could be a serious issue because patients, one, they may not take the medicine, they may not understand the importance of taking the medicine, and therefore the treatment will not work. These people's health will deteriorate and they will either die or become in a worse state than they were before. It's a high probability that they will discontinue taking the medicine. Therefore, it's very important that healthcare professionals motivate these patients to take their medicine, to follow the treatments. And this is all done through good communication and interaction with these patients. Therefore, what I sought out to do was improve how I interacted with people. And what I did was I volunteered to teach at a youth program. This program was called the Vietnamese Eucharistic Youth Movement. And what I did was I primarily worked with children aged 10 to 11 years old. And I would be in charge of helping tutor math, and I would also help teach Vietnamese for a little bit. During math, if a child would bring me a complex problem, or what they thought was a complex problem, I would help them by breaking down the problem into multiple parts or multiple steps. What this allowed the child to see was that they could solve these little steps, and if they all combined it, they would be able to solve the problem as a whole. This is similar to what I did when I taught Vietnamese. Vietnamese is a completely different language, so it would be like teaching biology to someone who had no biology background. And how I taught Vietnamese was I would first off translate the language into something that, in this case, it was English translation. And I would help them help them spell the word by mimicking words in English. Therefore, they would be able to spell the word and they had a rough understanding. And therefore, what I did next is I would make them use it in sentences, and this would help them fully understand the meaning of the word and understand how to use it. How this relates to the health field is when a patient is being read their diagnosis by the doctor, they have no biological or science background is what's presumed. And the doctor, what they need to do is list out their diagnosis, of course, but to also explain and break down that diagnosis in a way that's understandable to the patient. If the doctor cannot explain efficiently what's happening to the patient, then the patient's going to go home not understanding what's happening to their body and how serious their health issue is. Therefore, it's up to the doctor to find a way to explain it. And I've seen this in multiple offices where the doctor will make analogies to something that's relatable, that's very common in common day life for the patient to understand. I think this is one of the most valuable things I learned working with these children, is that you need to break down complex topics or words to something that they can understand and digest. And this, therefore, they're going to understand it and remember it, and it will actually be useful to them later on. Another thing I learned during this service learning program was how to motivate these children to learn. During this age 10 to 11, they were kind of wild. They may not have wanted to learn or be there on a Sunday, of course. And it's up to the teacher's job to motivate these children to learn and to continue to study. Many of these children were asking, why do we need to learn Vietnamese? And it's true, but by explaining to them the importance of learning a second language and giving out rewards, they were motivated to learn. In this case, what I would do is I would bring candy to motivate them, and if they answered questions, I would give them candy. How this is relating to the health field is, in the health field, doctors need to motivate these patients to get better. How doctors do it in this case is that they will scare the patients with their diagnosis. Doctors will explain the severity of the issues to the patients, and they're going to list the benefits of these treatments or medications, and they're also giving side effects. What the doctor's job is to motivate these patients to continue down these treatments and to explain why they're so important for the continued health and life of these patients. A major issue currently is that a high number of patients are not taking their medication and they're not following the doctor's orders or recommendations. Some studies have shown that 1/3 of kidney transplant patients don't take their anti-rejection medications. These are patients that have gotten donated kidneys, and their only job is to continuously take these anti-rejection medications until the kidney has fully adopted to this new body. But since these patients do not understand what's happening and do not understand the importance of continually taking these medicines, what happens is the kidney will reject the body and the kidney will die. This is a waste of the donated organ, and there's a lack of these kidneys, and to be given one and to lose a kidney is just terrible in general. Overall, if patients are able to understand and continue to take these medications, scenarios like this would not happen. Some other statistics, such as 41% of heart attack patients don't take blood pressure medication, is a serious alarm that doctors and healthcare professionals are not explaining the importance of these drugs to their patients. And for example, another issue is antibiotics, which is because antibiotics are not becoming efficient because people are not finishing the prescription. Therefore, they gain immunity to these antibiotics. Thus, people need to create new antibiotics and they can't catch up with the new mutating population. Overall, a major percentage, over 29% of patients, stop taking their medication before it runs out. Why this is a big issue is because they're not getting the treatment they deserve. They're missing out on the full, complete recovery that the doctors are trying to get them. And what I think needs to be done is that healthcare professionals, if they're trained to work and communicate better with the public, with their patients, they will be able to teach them, to make them understand the importance of these treatments and to help the patients undergo these treatments. The doctor cannot be a part of the recovery all the way. They can only give out recommendations, prescriptions, and certain procedures. It's up to the patient to motivate themselves to continue taking these medicines, to go to rehab, to go to physical therapy, to recover their bodies. It's so important for healthcare professionals to teach them this, to motivate them. And that's why it's my belief that those in the health field should be more trained and experienced with dealing with patients, since it's going to lead to a better outcome. I have this chart. So if there's an informed patient, they're going to make a better choice. And if they make better choices on what type of treatments or drugs they want, or if they make better choices to continue taking their medicine, they're going to have better health outcomes. And then another way to do this is if a patient is informed, they're going to be better motivated to continue to take these medications, and this will lead to better health outcomes again. Overall, I want to conclude with healthcare professionals need to be able to interact with patients better, to communicate their thoughts and ideas, and to communicate the importance of these treatments and the way that these treatments or medications need to be taken. Overall, I hope that there's more focus on how patients and healthcare professionals interact, and that this way of communication gets better in the future, and people will continue to follow the doctor's recommended treatment plan or finish their medication. Thank you for listening to my presentation.